And members of the fourth estate, we invited you here this morning because of a promise that we gave to you 2 weeks ago, when most of you called this office, interacted with my colleagues, and wanted to find out in respect of our doctors in Cuba, among other things. And we thought it would be better for us to have a comprehensive conversation around that matter and many more. So allow me to first of all take you through a written press statement. This week, colleagues, as you know, the government of Kenya hosted Her Excellency Mrs. Ines Champman, who is the Vice President of the Council of States and Ministers of the Republic of Cuba, who was here for a state visit following a historic visit by His Excellency President Uhuru Kenyatta to Cuba last year in March, which was later on followed up by a visit of myself, and several MOUs were entered into during the state visit of the President. The visit of the Vice President was largely to follow up on the bilateral cooperation between our two nations. As the Kenyan government implements the Big Four agenda, the Cuban model of healthcare continues to provide lessons and strategies in primary healthcare, continues to give us lessons on their strong referral systems, continues to give us lessons on the vibrant health research and innovation, which has yielded desired health outcomes in Cuba, with a life expectancy of 85 years. Kenya stands, therefore, to gain immense knowledge from Cuba's many years of experience in strengthening its health systems and providing UHC for its citizens, despite of the realities of the harsh economic conditions in that nation. In pursuit of the enhanced bilateral collaboration, this ministry and the Ministry of Public Health in Cuba have prioritized the following programs, which are of high strategic importance to the relations between the two countries for implementation. These priorities include: 1, enhanced service delivery and capacity building, which is being attained through 3 interventions. 1, it is recruitment of the Cuban medical specialists who are currently working in 47 counties in this country and in the health facilities in those counties. 2, undergraduate training in medicine. 3, postgraduate training of Kenyan doctors, particularly in family medicine. Gentlemen, ladies and gentlemen, since the year 2005, the Cuban government has offered scholarships to the Kenyan government in the field of medicine. At present, we have 2 scholarships which are offered in medicine at undergraduate level each year by the government of Cuba. In addition to this, and known to us, is that we have 100 Cuban specialists working in Kenyan health facilities, but we also have 48 Kenyan students who are studying family medicine in Cuba. And to further strengthen primary health care at the counties, the Kenya Medical Training College, a state agency under this ministry, is training clinical officers, nurses, and community health workers in family medicine, having borrowed a leaf from the training at this level in Cuba. Number 2 strategy is on implementation of the malaria vector control project using biolarvicides in 8 counties in western Kenyan region. This project again, will be launched towards the end of this month as soon as we've completed the necessary administrative procedures which we are currently working on. On their part, the Cuban government committed to fast-track the interventions that they need to be able to lend support and ensure this project becomes a reality at the soonest time possible. Number 3 area of collaboration is the health research collaboration, which is between KEMRI, again the research arm of government on matters medicine, and the Cuban Biomedical Institute. In the coming months, the Cuban government will be sending a team of research scientists to Kenya to develop joint projects with the Kenyan counterparts from KEMRI. Initial discussions on this matter will allow for us to take on the novel diabetic food therapy, and vaccine development and production of the same have already commenced. Again,